Overcoming back pain can feel like a slog. It can feel like it's ruining your life, especially when it goes on for a long time. I'm a physiotherapist. I've seen a lot of it. I've helped a lot of people, and I want to keep helping people. And I want to give you the truth so that you can help yourself and get past all the rubbish, all the misinformation that you see online. So, first of all, what I want you to know is that this is a general framework. It's not a one-size-fits-all system that's going to work for absolutely everyone. Everyone's journey will look different. Everyone's different. That's just the way it's going to be. And it's backed by clinical guidelines like the NICE guidelines, research in the Lancet, and also by my professional experience as a physiotherapist. So this is really for people with non-specific back pain, which accounts for about 90% roughly of low back pain, and around the same. There's research that says different things. Around the same for sort of mid and upper back pain too. So the real aim of this is to give you clarity and confidence that recovery is possible. Let's get into it. So, number one, the first thing that you have to start with is belief that recovery is possible. Because if you don't think that you're going to recover, the chances of you doing so are going to be greatly diminished. So belief is where we have to start with this. So first of all, you have to understand a few things. Understanding that pain does not mean that you're broken. Pain doesn't equal damage, is what we always say. Understanding that is vital, because if you continue to think that you're broken, that this is just the way your back is, it's in this state, it's, from an accident, or the pain's been going on this long, then you're really limiting the chance of recovery, and it's just not going to help you. So negative beliefs like this, like I'm weak, I'm broken, I'm incapable of change, I've got this condition, I've got degenerative discs or whatever, can actually affect and amplify pain. So concentrating on what we can control is the main thing for starting recovery. So a hopeful, confident mindset is the foundation of recovery. Believing that change is possible, even if it's going to be slow, even if it's going to be hard work, it is possible. Because even if you're doing the things that are going to get you back to where you want to be, if you don't believe that they're going to work, you're not going to keep them up, and they're not going to be as effective. So you have to buy into it totally in order for it to be more effective. Also understand that recovery is common. Around 95% of people recover from non-specific back pain within a year. That's 19 out of 20 people. But it does take the right approach a lot of the time. And if you've got this negative belief that you're not going to recover, or that you're weak or broken, then your chance of recovery is going to be so much worse. So again, step one has to be belief that recovery is possible. On to step two. Understanding pain. Look, I don't need you to understand all the neuroscience of pain and everything like that, but a basic understanding of pain, how it works, how it affects you, and what you can do about it is important. So one of the most essential things to know is that pain does not equal damage. And that's especially true with sort of long-term non-specific back pain. So people often say that they've got degenerative discs, that they've got a bulging disc, that they've got arthritis, and these different conditions, or that they're kyphotic, like they're hunched forward and things like that. And these are the reasons for their pain. But it's actually a lot more complex than that. And people really undervalue the things that affect their back pain and overvalue things that actually have very little effect on their back pain. For example, the way that you think about pain has a huge effect on your back pain. But people don't really realize that. They don't value it as much. But they think the way that they're sitting has a massive effect on their pain. But that's actually shown to have a very little effect. So it's really about understanding your pain and getting back to knowing what really matters to help you back to recovery. So pain can be a sensitive alarm, not an injury detector. And what this really means is that your nervous system that supplies your brain with thoughts and feelings is, well, not thoughts, but feelings and sensations, is basically overly sensitive, so that if there's a sort of line of where you reach pain, if normally it's up here and you're doing things through the day like bending forward to tie your shoelaces and sitting for an hour, then the pain doesn't really get hit. But when your alarm system is overly sensitive, this comes down, so that tying your shoelaces creates pain, sitting for too long creates pain, and these are just things that aren't really going to do any damage, but are conceived by your nervous system and by your brain as being dangerous. So fear and misunderstanding often fuel long-term pain. So again, if you think that sitting or bending or twisting or anything that should be easy and simple is dangerous for you and is hurting you, then that's actually fueling your pain. Because when you're in that fight or flight state, when that system is heightened, then you are more sensitive to pain. Your sleep is worse, your stress is worse. Everything gets pushed towards amplifying that pain. And that's the exact opposite of what you want to do. You want to do things to calm your nervous system. So directing your attention to things that are going to do that rather than things that are going to amplify the pain. It's very easy to sort of become very, what's the word? Sort of just to read into the pain too much. Oh, did I do this? Did I sit in exactly the right way? Did I tie my shoelaces right? Did I bend my spine slightly when I did that? And it's like you become almost neurotic about it, and that feeds into sensitizing that alarm system as well, and just worsens pain. So education really reduces fear, and that means less fear, less pain. So learning about pain, like you're doing right now if you're watching this video, is a really useful way of helping to start overcome it. Number 3, calming the nervous system. So we said about educating yourself about pain and not sort of amplifying your nervous system, but what about doing things to try and get it to actively calm down? So higher stress, louder pain signals. It's quite obvious, really. A lot of people will say when they've had a busy week or a really hard day that their back pain is a lot worse. But it's not because they've, been carrying heavy weights or sitting in a certain way. It's because they're stressed and they're just in a state of high stress, and then also in a state of high sensitivity because of that stress. So chronic pain can mean an active fight or flight system, and we really want to reduce that. So what are the best ways to reduce that? So mindfulness and stress management, calming the system. So what is mindfulness? Mindfulness is really just a non-judgmental awareness of the presence. So it's really about where you're directing your attention. You can direct your attention into the sensations in your body and in a non-judgmental way, because if you do that with fear, then you increase the fight or flight. But if you do it in a way where it's like you're just sort of watching yourself, then you're able to bring down that fear and that fight or flight state. And then that really can get you back into that rest and digest state where you are less sensitive to pain, and it does help over time. So that's a great approach. But also, managing stress is part of the treatment. So if you've got relationships, jobs, commutes, whatever, things in your life that really stress you out, I know it's easier said than done to just change those things. But if you're really serious about recovery, maybe some things need to be altered slightly, and that's totally up to you to decide what needs to change, because stress and pain are a lot closer linked than you're probably giving them credit for. So on to number 4, gradual exposure to movement. As a physio, one of the main things that we do is get people to start moving again, and then increase that movement over time gradually, depending on how they react and handle it. So we say movement is medicine, but it has to be progressive. You can't just stay with doing the same very low level, very easy really exercises and expect to have progressive change. You know, you're not going to go to the gym every day and lift the same weights and expect to keep growing muscle month after month. It doesn't make sense. You have to have a strong enough stimulus to get a result. So a good thing to know is that you don't have to be pain-free to start, but you do have to move to reduce pain. So I work on a sort of sliding scale that if your pain is low, then you can have a high amount of movement. So more range of motion, more resistance, more time moving, all those kind of things can go up. But if you've got a high level of pain, then you just reduce the resistance, you reduce the range of motion, you reduce the stresses, the active movement stresses that you're handling. And the important thing is to understand where you're starting from, because you may think, if you're sort of in a catastrophizing state and you think, oh my God, this back pain is terrible, where would you really rate the pain? Because in all likelihood, it could be worse, right? You're probably not watching this from hospital. So starting where you are, understanding what you can handle. Usually it's more than you think, but take that with a pinch of salt because everyone is different. And then gradually increasing that over time. So this could be anything from, it doesn't have to be just resistance exercise and increasing the weight. It could be things like just going for a walk or a swim or cycle or doing a yoga class or anything that you are going to be able to do consistently over a long time. So that goes on nicely to the next point, that all movement counts and there's no single sort of magical exercises. There's a lot of things online that say you have to do this exercise, you have to do it in this, do it in this particular way in order for it to work. And it's just not true. You know, I think the best thing you can do is something that you enjoy because you're going to stay doing it. And that's the most important thing, consistency, right? And if you can do something where you can track your effort and your work rate, then, and sort of actively increase it gradually over time, depending on what you can handle, that's the best way to go. You don't need to be too overly neurotic about, oh, I did 1 kilo this day and then I did slightly less the next day. It's like, you don't need to be that anal about it, basically. Just recovery is more like this than like this. It's never going to be totally linear. So, you know, don't take it too seriously. Right, let's move on. Point 5. Improving general health and daily habits. So, general health feeds into back pain a lot more than most people would give it credit for. So, sleep is a massive one. And it's not because of your bed most of the time, right? So why do people's back pain improve when they get a nice comfortable mattress? It's not because of the perfect alignment of their spine. It's because they got a good night's sleep. And that good night's sleep helps them to reduce the sensitivity of their nervous system, to have the energy the next day. You know, these are the things that are important, just getting quality sleep. So if you do struggle with sleep, you know, doing things like setting regular alarms and avoiding blue light at night, you know, you can go and search these things. I'll probably touch on it on future videos as well. But doing these things that are actually going to actively help you get better sleep, you know, avoiding alcohol and caffeine and things like that too late in the day. Stress, again, a massive one. If your body is in high alert, then your pain is going to be worse. No questions about it, really. But what can you do to reduce your stress? Again, we could go back to mindfulness. Exercise is a great stress reduction tool. Getting good sleep is great for stress reduction. Activity. So I know we touched on exercise already and about sort of progressively increasing the amount of activity you're doing. But on top of that, think about the simple things like how many steps you do in a day. I think the average in the UK is something ridiculous like 3,000 steps a day, which is just pathetic. So they're getting that up. So you don't need to do 10,000, but if you're doing 4,000 and then you start doing 5,000 consistently, that's a win as far as I'm concerned. It doesn't need to be anything massive. And then just realizing that the small tweaks actually do add up to make a huge pain reduction over time. So really don't underestimate the effects that your general health have on your back pain. Number 6, staying consistent and being patient. Look, back pain can take a long time to recover from in some instances, unfortunately. And like I said again, recovery most of the time is not linear. You will have up and downs, and that's just perfectly normal. It's part of the process. And understanding that, like I say, back to the pain education, understanding that and not letting it freak you out and sort of increase your fight or flight state is really fundamental to getting back and becoming pain free, hopefully in the long term. So again, consistency is better than intensity. You're better off doing something, if you're gonna, let's say you have an exercise program and you do it consistently 3 times a week for the foreseeable future, say for the next year, that's much better than going to the gym every single day for a fortnight and then giving up. The results are really from what you do consistently, not what you just do every now and then and push yourself too hard on and then regret it later on. So the next point, stay adaptable, but keep moving forward. So understand that there's going to be challenges. Like I said, recovery is not linear. But if you're having a pain flare up and your physical activity has to come down, maybe, what else can you work on? Maybe you can work on improving your sleep. Or work on improving your stress levels. There's always something that you can do to keep moving forward. Or maybe it's just about learning, I don't know, all the nonsense facts that you see online, learning the truth about them. That can be really useful as well. Because people that feed you fear don't have your best interests at heart. I can say that confidently. They're either just trying to sell you their course or their product, or they're misinformed and they don't know that being in fear only makes pain, particularly chronic pain, worse. Finally, trust the process even when it feels slow. Like I say, it's not linear. It's you have to be adaptable, and it can take a long time. So just staying with it, sticking with the good habits that are going to help you will ultimately be the best thing that you can do. Just a quick recap. So, number 1, you have to believe that recovery is possible. If you don't, the likelihood that you will improve and that you will stick to things that actually help you out is going to be massively diminished. Understand your pain. Listen to people who know what they're talking about. I'm not the absolute, I don't know, an absolute know-it-all about everything to do with health, but I think I give good advice around back pain. And if you want to know, the hundreds of myths that are out there, I can tell you what's true and what's not, and what you should be believing in order to actually help yourself. Thirdly, calm your nervous system. Do it practicing things like mindfulness. Avoiding things that are overly stressing you is a massively useful step towards recovery. Number 4, gradual exposure to movement. Again, no magical exercises, just gradually doing something that you can stay consistent with over time. Number 5, improve general health and daily habits. So I like to think about stress, sleep, and sociability as well, really. That's something I didn't really touch on earlier. So having a good social life is actually a massive benefit for any kind of chronic pain. But there's a lot of research to do with that and overcoming back pain as well. So something to bear in mind. Number 6, stay consistent and be patient. It can take a long time, but keep the faith and your chances will stay high. So remember, you can overcome back pain, and you don't have to be perfect to do it. You just have to stick to the basic things that are going to help you. You know, there's no magic pills, and a lot of the time the magic pills that do exist don't really work. So understand that most of the things that are going to help are completely under your control. Here I'm just touching on the things that are under your control as well. I'm not talking about things like genetics, which do matter and can predispose you to pain more, but ultimately the things that you do, the way that you live, are more important than anything else. So if you want to overcome back pain without the drugs, without the surgery or injections, then I'm going to keep giving you good information, and let's hope it helps.